in the 12 years of practicing physical therapy, I've worked in a lot of different scenarios, primarily outpatient orthopedics, and seeing the trends of reduced treatment times, higher emphasis on aids and assistance to provide intervention, and seeing multiple patients per hour did not correlate with my desire to help people to their highest potential. I opened IPA Physio to not be burdened by those restrictions, and I provide my time for an hour with each of my patients where I can be completely engaged in their whole case and to manage them more comprehensively and more effectively to the standards that I hold for my patient care.
There we go. All right.
I was told I was going to have surgery. People would look at me within 5 minutes telling me that I had to schedule the surgery. The neck pain interfered with my ability to work a full 8 hours. I started having muscle spasms pretty much hourly that would cause me to stop and go take a break and cry. It was so painful. My first treatment with Foster was different than any other treatment I'd received from previous practitioners. He stopped the muscle spasms within the first treatment. He reassured me at great length. He'd look me in the eye, he'd hold my hand and say, "You're going to get better." And that's not something I had heard previously from anyone. After multiple treatments and laser therapy, life resumed and it was actually less painful than it was before.
Foster has been able to get results where other therapists haven't been able to, and I've never seen another therapist work so hard for their patient. I had results in probably 2 weeks that I hadn't had other places in 6 or 8 weeks.
There we go.
Functional manual therapy is the foundational approach that's consistent across all of our IPA Physio locations. This approach tries to optimize function in the person to get them back to as healthy of a body as they possibly can have.
Managing acute and chronic musculoskeletal conditions requires the therapist to be very eclectic and adaptable in their treatment approach. The FMT paradigm has allowed me to effectively manage most conditions to high levels of resolution. However, in the states where tissues are physically degenerative or have a biochemical limitation to how fast they're responding, oftentimes you need to support that tissue with an outside stimulus. We deploy the BioFlex Laser system during those cases to nourish the tissues and to provide them the energy to return to a more optimal state of function.
A foundational premise in functional manual therapy is that every patient has untapped potential, and we believe that wholeheartedly. When anybody walks in these doors, we're looking to try and find the things that we can improve in them and that there's definitely hope for them to get better. We've put everything into developing ourselves as experts.
You're going to start to feel that left foot engaging quite a bit there.
We've spent countless hours in continuing education courses, and the entire reason is because we have a passion about helping people. We hope that that passion can get through to those that we're able to touch as patients.